Good morning, everyone. I'm counting my lucky stars. I didn't have to leap down that stage, otherwise this could have gone very differently. Totally thrilled to be here this morning. Thank you so much to the Raine Foundation and co-funders for this priming grant and also for recognition as the Raine Robson BrightSpark Fellow. It's incredible. And I have the absolute privilege this morning of telling you what this funding will mean for tens of thousands of young people here in WA and hundreds of thousands across Australia. And the children I'm talking about are those who live every day struggling not only with the way that they feel about themselves and others or their mental health, but also with their use and understanding of language, whether that be talking, listening, reading or writing. I worked clinically as a speech therapist for a number of years and for too long saw too many children and teenagers who had both of these difficulties simply falling through the cracks of our mental health system that didn't understand them and didn't understand their needs. And I'm excited that this funding will mean that we can finally do something about that. But before I go into that project or this funded project a little bit further, I want to paint the scale of the issue a little bit more for you. In WA, we have around 30 students in every classroom, right? And we know that 2 to 4 of those students will have a clinical literacy or language disorder. So these are things like dyslexia or reading difficulties or developmental language disorder, the most common neurodevelopmental condition that causes persistent and pervasive difficulties with spoken language. And unfortunately for these students, these disorders mean that they are 4 times more likely than their friends to feel anxious, to feel depressed, to act out and get in trouble, including in trouble with the law, and to think about suicide. On the flip side of that coin, around Australia, we have around 600,000 young people with diagnosed mental health conditions. And what we also know is that 80% of those young people, or over 500,000, are also likely to have unidentified language and communication difficulties. Now, I apologise that that's a lot of numbers to throw at you this early on a Monday morning, probably before a lot of us have even had breakfast, but it's important that I include them because I want to stress to you what they mean. What they mean is that young people with language difficulties are overrepresented amongst those who are trying to access and engage in our mental health system. They make up the majority of these young people. And in almost a bit of a cruel irony, our mental health system doesn't understand them or their needs, and this is why they are falling through the cracks of our service. Over the last couple of years, I've led work to try and understand exactly why this problem is occurring, and through some awesome work with very amazing members of the community and mental health professionals, we've boiled it down to 2 key problems. The first is that the interventions that we deliver in our mental health system are too language heavy, right? They're literally called talking therapies. Things like cognitive behaviour therapy rely really heavily on our ability to use and understand spoken and written language, and for that reason they are inaccessible in their current form to young people with language difficulties who, remember, make up the majority of the group trying to access and engage in mental health care. The second problem is that our mental health workforce isn't trained to understand language difficulties, to understand how they impact on mental health, and also how to change the way in which mental health treatments are delivered to make it easier for these young people to access and engage. Also through this work, I've worked with the community to identify how we can fix these problems. And they've identified 2 achievable solutions to these issues that this funding will facilitate. In order to co-design these solutions though, first we need to take a really deep dive through a series of interviews and a survey study to understand exactly why mental health treatments are difficult to access and engage in for these young people. We also want to know exactly what mental health professionals need to know and to be able to do in order to make sure mental health services are inclusive and accessible to this group. All of this information will help us or will inform a really comprehensive co-design phase to this work. We'll work for a large number of hours with young people with language difficulties, their families and mental health professionals to co-design and test 2 of these solutions that the community has identified. One is an online toolkit of information about mental health and language difficulties that is inclusive and accessible or written accessibly for these young people. and also a set of advocacy resources which will allow these young people or give them the words to advocate for themselves and for their mental health needs. The second is an adapted version of a mental health waitlist intervention to make sure that young people with language difficulties get the support they need while they're waiting for formal mental health services. So overall, and then I work with our amazing, can't forget this, amazing community and industry partners to roll out these interventions or these solutions into routine service delivery and practice. So all in all, this funding is amazing because we will be able to develop and test world-first, scalable and community-identified solutions to the current problem of inaccessible mental health care for young people with language difficulties who make up the majority, I'm going to keep saying that, the majority of young people trying to access our mental health system. We will be able to bridge the gap between what these young people need and the supports that currently exist to help them, and make sure that no longer do these young people fall through the cracks of a system that doesn't understand them. Thank you again from the bottom of my heart to the Raine Foundation and co-funders for turning this community's priority into a reality. And I really want to extend my congratulations to the fellow award recipients today. I can't wait to get to know you and the work that you're doing. Thank you very much.